regular meetings and updates, but I'd like you to trust me to decide in consultation with Billy about what we share. Now, if Billy's a teenager, there's more that I would say. So, Billy's a teenager, and teenagers often want to talk about stuff like smoking, drinking, and sex. So let's talk about this as a family, about how do you feel about that. And because you generally want to have that clear. There's a fictitious case that I made up of a 16-year-old girl, 15, probably better to make her 15 in Pennsylvania, given the age of consent. And the name I used was Donna Rhea. And Donna is seeing you, and her parents brought her to see you because she's depressed. Not uncommon in the adolescent female population. So she's depressed, you're coming in therapy, you're talking with her, you've got a good relationship with Donna, and Donna tells you that her boyfriend, also 15, and she are going to do it at his house this weekend. His parents are away. And all of a sudden, therapy alarms go off. What are your obligations? Well, at the very least, you probably want to make sure Donna's not being coerced. Donna has a knowledge of sex practices. But wait, is that child abuse? Is that statutory rape because they're underage? Do you have to tell the parents? How do you handle the situation? Well, let's bump it up. Suppose Donna's 15 and her boyfriend's an 18-year-old senior. She's had a little trouble graduating from high school. Or a 20-year-old college student. Oh, let's make it even better. Let's suppose he's a 35-year-old neighborhood drug dealer who's swapping marijuana or cocaine in exchange for sexual favors. You see the little continuum I'm describing here, which is a continuum of risk, where I'm making the situation increasingly risky. Some point along that continuum, you probably are going to decide, have to talk to the parents about this. But again, this is something where you need to think about things carefully in advance. Now, I know